Welcome to Day 4 of Webinar Week. We hope you have enjoyed this event. So far, we've had over 720 registrations for the live webinars this week, and even more people have tuned in to watch the 9 on-demand webinars we released earlier this week. If you missed any of the live webinars or haven't made time to view the on-demand webinars, you can visit webinarweek.live to find all of the presentations. Don't forget, tomorrow we will announce the winner of our grand prize drawing. One lucky attendee will win an all-expenses-paid trip to MD Expo Tampa this November 8th and 9th at the Tampa Marriott Water Street. You can learn more about this conference by visiting mdexposhow.com. But be sure to keep an eye on our TechNation Facebook page to see who wins the trip. You can find us on Facebook by visiting the facebook.com/TechNationMag. You will find a PDF available for download on the handout section of your webinar dashboard. This PDF is the pre-show planner for the upcoming HTM mixers. Join us in Colorado on August 19th and 20th, in Wisconsin on October 1st and 2nd, and Southern California on December 9th and 10th. Visit htmmixer.com for more details. We want to extend a big thank you to our sponsor today, Armis. Armis is the leading agentless device security platform purpose-built to protect the world of unmanaged and IoT devices, providing passive, real-time, and continuous asset inventory, risk management, and detection and response to prevent cyber attacks from disrupting and compromising your business. We are joined by Chris Dobrik, VP of Product Marketing. Chris would like to say a few words before we announce today's presenters. Chris, the floor is yours.
Thank you very much, and welcome everyone. Once again, my name is Chris Dobrik. I lead product marketing at Armis, the agentless device security company. And today's session, maintaining an in-house medical device security program, is a wonderful topic, and looking forward to today's content. But to help set the stage for what the content is today, I wanted to talk a little bit about Armis and cybersecurity in general. So today's topic is particularly salient given the number of cybersecurity incidents that are hitting healthcare these days. Unfortunately, we have a situation where, while healthcare organizations are contending with the pandemic, that there are nefarious actors out there that are taking advantage of the situation, and we're seeing countless stories in the news of attacks on hospitals and other healthcare delivery organizations, particularly ransomware, and this is a problem. So today's session is going to be particularly important. When it comes to medical device security, there are a number of challenges there, and I'm sure our speakers are going to be speaking to that. But the way we look at this is that there's 3 primary challenges. Number one, all these devices are increasingly connected to each other and the broader internet, which introduces new potential challenges as it pertains to cybersecurity. And unfortunately, many of these devices don't have any security built in. They don't have the ability to take a traditional security agent, and while you can use vulnerability scanners to scan these devices, that can be problematic, as they can potentially disrupt or even crash these systems. So when it comes to looking at in-house medical device cybersecurity programs, what we like to look at it, or how we like to look at how you would form that, is what we call the new Hippocratic Oath. And that's really where clinical engineering, biomed engineering, and IT and security come together to really look after, how do I maintain patient safety? How do I look at all the modern techniques for building out highly scalable systems, and as well keeping an eye to all the latest cybersecurity threats and techniques? And so this is the basis for how we think about an in-house medical device security program. And what this affords, of course, is the ability to, keep an eye on human safety, patient safety, but also, reduce any costs related to operational downtime or time that's spent on incident response. It also gives us the ability to focus on keeping an eye towards the risk of any patient data or breach that may get out, as well as maintaining our compliance, with the regulatory environment. So Our mission at ARMIS as the agentless device security company is really to enable organizations to adopt all these new types of connected devices without fear of compromise from cyber attack. And so how do we do this? And I wanted to spend just 2 minutes on a recent project that we were engaged in with a large healthcare delivery organization where they had two primary things that they were focused on. Number one was how to do asset and device discovery. So the key challenge that this particular organization had was visibility and identifying all the devices that were in their systems. The second was they had suspected that there was some ransomware activity, and so they wanted to perform some threat analysis there. Their particular areas of concern were classic cyber activity in terms of malicious domains and botnets, ransomwares, but also they were concerned about vulnerabilities that are focused on things like medical devices. Urgent 11, for example, is a vulnerability that targets real-time operating systems that are employed in a lot of medical devices, as well as CD-Pwn, which is a vulnerability in Cisco infrastructure. As we engaged them, what we found was some interesting data. Number one, we saw a lot of SMB v1 traffic. We saw heavy port scan activity, and all these were indicative of some malicious behavior. And lo and behold, what did we discover? There was actually a WannaCry incident that was on the hospital network. And so what was happening here was you had WannaCry coming in from the traditional IT side, but then jumping into separate VLANs in which the medical equipment was residing, and even infecting some of those medical devices as well. And so the key thing that I wanted to impart on you folks today is, as you're thinking about your in-house medical device cybersecurity programs, really get back to basics. You know, first and foremost, understand, what do I have? Do I have a full accounting of my asset inventory, all my medical devices, all the IT devices that may be interconnecting with those? You know, and then asking yourself the question, why do I care? Am I tracking the behavior? Do I understand what's going on? Do I understand, is there unencrypted data coming from the GE Healthcare CareScape network onto the intranet that could be compromised in a breach? And then from there, what action do I take? Can I quarantine the devices? Can I kick them off the network? That sort of thing. And so with that as a background, I just wanted to say thank you for a few moments to introduce you to ARMIS. If you want more information, please visit www.armis.com/solutions/medical-device-security. And now let me turn it over to the stars of the show today, Dave Yaeger and Rob Bundick. Thank you.
Thank you, Chris. For more information on ARMIS's products and services, please visit armis.com. All right, today's webinar is titled Maintaining an In-House Medical Device Cybersecurity Program. Our presenters are Dave Yaeger, Biomed Security Administrator for ProHealth Care, and Rob Bundick, Director HTM and Biomedical Engineering for ProHealth Care. Together, they are going to provide us with an understanding of how they created a cybersecurity program in their own facilities, and if a program is already in place, how to keep progress moving forward for a secure and protected facility. Rob, you may begin whenever you are ready.
Thank you. Again, this is Rob Bundick, the Director for both Healthcare Technology Management and Biomedical Engineering. We service 3 hospitals in the Waukesha area. We're a community-based, not-for-profit system, roughly about 360 beds, 13 clinics. We have a freestanding emergency department that serves one of our outlying communities, a regional cancer center, and then we partnerships with a couple of surgery departments and an endoscopy center. So biomedical engineering and healthcare technology management for us are actually split into 2 departments. Biomedical engineering being the service department, the HTM department being things that are related to the actual ownership of the device. In our organization, everything from acquisition to the disposition of equipment rolls up under my control, and we have those functions split out between 2 departments. So our biomedical engineering department consists of a supervisor, an admin dispatcher, 7 biomed techs, 2 imaging techs, a senior imaging tech, and then 1 sort of hybrid engineer that services both biomed and some of the entry-level imaging equipment that we have titled as an imaging associate. Our healthcare technology management department is where a lot of the work outside of service happens. I roll up under the healthcare technology management department. We have Dave, who is our cybersecurity analyst, who's been with us about 3 years now since we started this program, and he'll get into that as we go through the presentation. We have a database analyst for our CMMS system, sort of the gatekeeper for all of our data. For us, it's key and important to make sure we have data integrity and have our inventory as accurate as possible. We have a medical device integration engineer that is responsible for working with IT for EMR integration, as well as our RTLS system that we have in our organization. Our biomedical equipment lifecycle planner is responsible for equipment disposition, equipment moving, selling of assets, relocation, donation, sort of managing the end of life for equipment planning. We do have a parts procurement specialist. Our engineers do not order their parts. When a part is needed and requested, it is passed up through a parts procurement specialist who goes out, sources that part, and actually updates the work order, as well as doing core exchanges for parts that have to be returned. And then 1 project manager for Biomed. So as we look at life cycle planning of equipment, so we do a 5-year replacement cycle or replacement plan for a lot of our equipment. All of our imaging equipment is under that plan, and a lot of our Biomed fleet equipment falls under that plan. This person is responsible for maintaining that 5-year plan of what equipment needs to be replaced, as well as coordinating the projects of that replacement as it happens. So with that, I can turn it over to Dave, and he can begin his presentation on how we have developed our program over the past few years. Dave?
Thanks, Rob. And thanks to Chris and Jamie as well, and to Technician, and honored to be able to speak with you all today. Hopefully you'll get something out of this presentation. So I wanted to start basically with the beginning, where we started from this aspect. And the one thing that most experts do agree on is that, and Chris alluded to this in his presentation, that you really want to have an accurate medical device inventory. If you don't know what you're trying to protect, then you really can't protect it. Whether it's on a software application like a CMMS or an Excel spreadsheet or whatever you need, you really need to understand what is on your network and what is talking on your network. So what do? We started this a long time ago in our CMMS, and we actually started using or collecting some data that's specific to our networking details. This is typically outside, at least from my experience, is usually not something that's thought of when you're doing a CMMS, gathering networking information, and I'll show you some of that in the next couple of slides. So it was understood early on that this networking information is critical for quick responses to vulnerability and recall device gathering. Most CMMSs are structured for being a collection of maintenance work orders, scheduling and dispatching work orders, and they do not typically store device networking and software information. So we here at ProHealth decided that let's expand the database on that and include some additional details to that. So here's a screenshot of one of our informatics page. It might be a little busy for you looking at this, but just wanted to kind of give you a little snapshot of what's going on with that. As you can see, there's statuses you can have, network statuses. I'm not going to go into detail on all of this, but you can check if it's networked, if it's not capable of being networked, if it's just not networked. Based on that trigger, there is different information that needs to be filled in. So if it is, in this instance, it's a network device, so we want to keep filling as much information as we can, so we can recall this data at any given time going forward needing this. If it's a not capable piece of equipment, like a thermometer of some sort, or something that just doesn't have any network capabilities, then you've checked the not networked, and pretty much all this can be left blank and we're good to go. So once you have a better inventory collection, what's the next step? So for us, it was to find an application that discovers additional things on our network, and that's kind of what Chris was talking to a little bit ago. And back in 2018, I guess, we started looking at some applications that were already out there at that time. And actually, before I even started in this, Rob and the IT department, mostly Rob, started searching for these types of applications. These applications connect to your network passively, so basically they're getting data fed to them, a lot what Chris was talking about earlier. And they identify and categorize what devices are on your network and watch their network traffic or flows. So again, we identified a need for this, and in 2020, now there's, we just knew of these 4 or 5 in the beginning. Now there's, probably dozens out there, probably a couple dozen. So do your due diligence. If you're looking at one of these applications, talk to a bunch of folks. Reach out to us if you want to. We can give you some information as well. So what we did in 2018, in the summer of 18, we did a proof of concept with several of the vendors. And in the proof of concept, we connected these, or had these servers sent in to us, and we passively connected them to our core switch. The core switch was given specific VLANs to send to the application. And when we did this, we did side-by-side relationship POCs, so we can see the exact same information going to multiple different vendors and see what the information was going to, how it was being handled on each of the different vendors. So again, the applications we looked at are connected to your network and sent information via a spanning port from your core switch, or there's another way you can do is you can tap taps located in strategic places to catch the traffic. They will then identify and categorize what devices are on your network and watch for abnormal traffic flow. Examples are traffic to foreign countries or servers it should not be talking with. There really isn't any reason that a CareScape monitor should be maybe talking to your PACS system. So you can see that crossbreed. If that's happening, then maybe there's something on that CareScape monitor that's not supposed to be, it's malicious and trying to talk to the PACS server. Pricing for these are based on the number of devices you have in accordance with how many facilities you want to monitor. So it's basically some sort of a subscription pricing. And our organization personally has about 30,000 total networked devices. 16,000 of them are IoT devices, with about 10% of those being medical devices. So in our medical world, we've got about 1,700 pieces of equipment that are on our network. So the majority of those 30,000 are IT managed, and so we don't really have to do too much with those. They're basically your servers and your workstations, potentially your phones and stuff of that nature. There are all managed by the IT department. So once we got this installed, well, let me back up one step. So we went through the proof of concept. We decided in the end of 2018 on a particular product. We had it installed in the beginning of 2019. And so once we got this installed with the expanded number of VLANs being sent to it, so now we expanded it to the whole organization, we quickly found out that in our instance, taking information off the core switch was detrimental to the core switch's capabilities of doing its information and doing its work. So we went back to the drawing board real quickly and decided we were going to do some taps. And so how we do this is we tap all the information coming through to the river, to our main data center. And that's basically what we consider north-south traffic. So it's good information to get that way. The only drawback would be is if you have east-west traffic, or if you have information that's being presented within a facility, it doesn't actually go to the data center, then that information won't be captured in the tap process, and you'll have to go back and put some sort of a sensor in that area. So we did change the taps, watching all traffic to our main data center, and that seemed to be a much better solution for us. So again, just things you want to consider when you're talking with one of these vendors is how it looks, how it's going to act, if it's going to cause some burden to your infrastructure, and then see if they have other options to be able to get that same traffic. So that application was put into play in the beginning of 2019. It sat, it just sits there and continually is monitoring the network. We are actively using that information to do various things, which I'll talk about here in a little bit. And it's alerting us to some things. It's got the capabilities, which most of these do now. These applications have the ability to tie into NIST or to CVE and download vulnerabilities directly from there. And then they can identify the equipment that is vulnerable in your network based on just the criteria that the particular vulnerability from CVE is identifying. It does also have the capability of checking on software applications and see what's well, I'll talk about it in a second. Not go off the script here. So we've the enhancements that we're actually asking, and this is part of that the baselining. The enhancements made to the application since the installation is we've worked with them in a crowdsourcing type of way to better classify and identify groups of medical devices based on the characteristics that the medical devices are actually presenting to the network. And that's how these applications work. They see the signatures that are coming off of layer 2 or layer 3 on the network side and grab that information, and that's the identifiers that they use to categorize the information on the network and then put it into a specific category. We've worked with integrations with our existing IT applications. There's all these applications actually have the ability to do APIs and a lot of connections to maybe to your ICE application, or to your Prime application, or to your LDAP application, so you can restrict who gets access to the application. There's a lot of APIs and existing integrations already embedded in these applications. So I would look into and work with your IT department to see what's capable, or what's willing, or what's anxious to be doing, what you want to actually try to do more and more of. And the ability to baseline network traffic to allow applications to alert if attempted traffic is noticed outside of the normal is another enhancement that we had asked for and got. And what that's talking about is once you've got a group of ultrasound units, let's just say, that we know the traffic is only supposed to be from the network servers that identify the LDAP authentication in a PAC server. There is no reason for these ultrasound units to talk directly to Epic or your EMR or EHR or to another cardiology system, because these are radiology ultrasounds. Then you can baseline those in this application, and if an attempt is to for this ultrasound to talk to something different, or if something is trying to talk to this ultrasound unit that's abnormal, an alert will be sent to us in an email, and we can investigate that and see if there's some sort of a malicious activity that's attempting to take place. Some other things that we've asked for and have have gotten, and they're already, some may be already embedded in the application, is the ability to manually import our asset records, which match records in the application by MAC addresses. And this is used just as a relationship between the CMMS and with the application. So we know that it's linked based on MAC address. It's linked. It's an accurate piece of equipment on both sides of the fence, and we're still hoping for that API to be able to update some of the information directly into the CMMS, just because these devices, again, on our network are talking real language from their own devices to the network, and we want to ensure that that real data is embedded into our CMMS, where most of the CMMS data, or not all, is manually inputted. So if we can have something automated that's accurate or more accurate, overwrite something that's been manually entered, then obviously that's a good process to do and keep you up to date. And an ability to interrogate a device for installed third-party applications and Microsoft patches. There's a couple of integrations already embedded in a particular application that can reach out to Microsoft devices and see what kind of third-party applications are running, software is running. Maybe it's Adobe, maybe it's SQL, maybe it's Java of some sort, and it should be able to tell you exactly what level those are at. Again, the ability to know that information is key when the federal government comes back and says Java version XYZ has got a vulnerability to it. We can then come back into hopefully our CMMS and just do a list out of there, or go into the application and do a list out of there, what's running that specific level of Java software. And you can target that versus sending all of your biomeds out there, or all your biomed engineers, and say, hey, go see if this application, or if this Java application is being run on your equipment. Just the time consumption that would take is just astronomical. So the ability to have everything embedded into either one or two applications, and then just pull that data out of that is just key, and for quickness and for accuracy. So the main reason that one of the main reasons that we got an application like this was to identify what was out there, right? So again, Chris alluded to this in his presentation. Most organizations don't have a real good handle on what's on their network, what it's talking to, how it's talking to things, if it's supposed to be talking to those things. And in talking with my IT department, and where we used to be in IT, there's a lot of devices, there's a lot of equipment out there that's unmanaged, even from anybody's aspect. IT's not managing it, Biomed's not managing it, so it's just these IoTs, these Internet of Things that are just sitting out there on our network, and nobody knows who owns them. It's just astronomical. It's phenomenal to think about that you can actually have all these things on your network, and over the course of years and years and years, these things just keep getting added, and documentation's not well preserved. And so all of a sudden you got all these things out there that are on your network, not exactly understanding why, and it's just a spider's nest or a rat's nest, whichever you want to use. So you get this application, and you start identifying all these things, and you start categorizing these. And I'm working heavily with the IT team, with the security department, and with the networking team to identify these, to create this process that we call microsegmentation. And we'll talk a little bit, I'll show you a little bit pictorial on what it actually shows. But what the concept of that is to identify a like set of devices, let's just say a radiology ultrasound department, that we know, even if it's across multiple facilities and multiple buildings, they all have that same communication thought process. They're only going to be talking to the PACS, and they're only going to be talking to potentially maybe a remote login. So you can restrict on the network side, on the switch side, exactly what that talks to and from, kind of like I said a little earlier. And so this is what we're doing actively now. We're looking to get that over the next couple of years to get everything in the medical device world segmented, and then a lot of the IoT devices segmented as well. So this application that we've installed can assist with that by showing the normal and abnormal traffic, and it shows all the network flows that are north-south, and we can go ahead and determine if these are accurate network flows or inaccurate already, and we don't want to accept them as being normal or baseline, and we'll exclude those now, because you got to understand, when you put the application in today, it's only a snapshot of what's happening today and what is going on for the next couple of days. If it's doing bad things now, until you fix those bad things, it's going to continue to do bad things. So if it's already doing abnormal network flows and you didn't know it because it was just sitting there and nobody was monitoring it, until you mitigate that or remedy that, it's still going to continue to do those bad things. So that's one of the reasons that we look at an ultrasound group. We figure out with the PACS department, we figure out with the radiology department, what do you need to talk to? Yeah, these things are all good. Well, whatever these 15 network IP addresses, will allow those, but we'll restrict everything else. And that's kind of how segmentation works, a little bit more than I want to, kind of detail that I want to get into, but hopefully that is clarifying to you guys. All right, so what we can get out of this application, again, that same ultrasound group we'll figure out what the baseline is. We've determined that it wants to talk to these 15 IP addresses, whether they're internal or external IP addresses, because some of them are external. If you've got remote vendor access, you have to have that for support. You need to allow that. And what will happen is this application then can create an ACL, or access control list. We can get that out of the application, we trim that up, we make sure it's perfect, and we then create a group and apply that to the Cisco, in our instance, Cisco ISE, the Identity Service Engine, ICE. We do that with regards to all the MAC addresses. So let's just use an example. We've got 10 ultrasound machines, and they all do the same network flow. So we'll create an ACL out of that. We'll put it in ICE. We'll go ahead and identify one of those, and we'll use that as a test pilot, and we'll put that MAC address in that ICE profile, and then it'll be restricted to that ACL. Then what'll happen is it'll do its normal flow for 2 or 3 weeks, and we'll let it go, and then everything's fine. Then we'll go ahead and put the remaining units in that, and now we've got a whole group of radiology ultrasound machines that are segmented, and we're on our road to getting all of our medical devices segmented in the course of 2 years. So ACLs are created in many formats. In this application, you can get them dependent if you don't have Cisco ICE engine. If you have a different particular identity service engine, then most likely the application will be able to present an ACL that's in that format, and you can use that as well. And again, our goal is to have all medical devices and some unmanaged IoT devices segmented on our network within the next couple of years. Next. So again, considerations to remember. So if we have the radiology ultrasound machines that are in a segmented profile, and PACS decides to change their server IP addresses, well, then all of our radiology ultrasound machines won't be able to talk to that PACS server because it's a different IP address and it's not in the whitelist or the ACL list. So open communication has to be there between IT and Biomed, understanding that there is a potential that this is going to change, things are going to change, or if you get a communication from or a work order in Biomed saying, hey, all of a sudden all of my ultrasound machines can't talk, then we need to understand that, hey, okay, these are segmented. How we do that in our organization, again, back on our informatics page, we added this little area down here showing IP profile name, and this allows us to know that it is segmented, and there could be a problem with the segmentation rules. So what we'll do first off is, if it's a whole group of ultrasound machines, we'll probably go to the networking team and tell them, hey, remove those from the whitelist or from the ACL, so we can at least troubleshoot it better, but at least our organization continues to get radiology images to the PACS system so docs can read it and our patients can be treated. So again, open communication. I know in my world, I talk probably have 3 meetings a week now with IT, mostly around security stuff and this application and how we're doing the networking thing. So it's just, I can't stress that enough, is to have good open communications with your IT team. So yeah, I just want to show this page showing you that we do ID that we are segmenting and what the profile name for that is. So if somebody else that manages this ultrasound, if I'm on vacation or whatever, I'm golfing with my son, then they will have the ability to go and see this IT profile name and talk with the networking team and say, hey, can we troubleshoot this quickly? So there's just more communication, more documentation we're trying to get with here. So this is the pictorial I wanted to show you that I mentioned a little bit earlier. Just how this segmentation looks. And I'm doing a lot of focus on this because in our organization, that's really one of the keys we want to do, is we wanted to be able to identify and then isolate or segment the different groups of things that we had in our network. So as you can see on the left-hand part of this is scattered IoT devices or assets. They're just on the network. They may be in different VLANs, but the VLANs bridge to each other, so they're not really segmented very well. So if you get into that scatteredness, you can kind of talk to anything you want. When you get into organized microsegments, then you can kind of isolate it a lot better. Just a little bit busy screen here, but then it can show you all the things you can do with that. So another option for the inability to replace costly items in network, because they have the additional risk with the older softwares that were too expensive. So another reason to isolate or segment is in our scenario, if you've got big iron, as we call it, cath labs or MRIs or CT scanners that are probably $1 million items or ticket items themselves. If they're running older software, or they may be more vulnerable just because they function fine, they're in good shape, they're working, they're doing patients, they're keeping up with the data flow and the workload, but they're a vulnerable risk to the network. It's a good reason that you'd want to isolate them and get them segmented so you can keep them on the network. They still work on the network, but they only allowed to talk to and from what they need to talk to and from with. So our future plans and goals with this application, with our department, with this whole maintaining an in-house security posture, is defining an OS upgrade path. One thing I would encourage you to do, if you're not already, is to try to get into the procurement process, meaning if you know your organization's procurement process, if it is a kind of a structured process already, which I'm assuming it is, then try to get your nose in there from a security aspect and say, hey, what are you looking at? How are you trying to do this? What equipment have you compared other pieces of equipment? There's an MDS2 you can get, and you can look at that documentation for each of the products and see what their security postures are. If one's a little bit better security-wise than the other, make a recommendation to your procurement team. Say, hey, this particular product is still running Windows 7, but this product is already on Windows 10, and looks like it's got abilities to do some security aspects. Maybe we can add a security agent to it, or maybe we can do LDAP, authentication for users. It's any security tool you can get or any additional thing you can get with your products coming in the door try to do that. Also, in your procurement process, understand that the device ownership is probably going to span, at least in the Windows environment, 2 OS versions. So you need to know in the procurement process, what's the upgrade path? Who's paying for that now? Can you get it embedded in part of the cost of the original purchase? So when it comes to Windows 7 end of life, it was January this year, and you bought this last summer. Well, you bought it a Windows 7 device knowing that you're only going to have it for 7 months with getting security patching. So what was the vendor's upgrade path? Are they already talking about or getting to a place where they're going to have a Windows 10 version out to you? And if they are, do you have to pay for it, or is that something they will pay for? There's questions to have and questions to do. MDS analysis, MDS2 analysis, risk scoring, same thing I talked about a little bit earlier. More goals and plans, implement a new vendor and OS software as soon as possible. Again, it just makes common sense if you can. You probably do it in your home PCs. You keep up to date with Windows applications if you're a Windows user or a Microsoft user. If you're a Mac, I don't know how often their OS software comes out, but you want to keep up to date with those. You want to keep up to date with patching. So again, you got to do it in accordance with the vendor recommendations, and that seems to be my biggest struggle. And I'm sure out of the folks that are listening to this, you're probably shaking your head and say, yeah, I'm having trouble with my vendors trying to get patching too. So try to work with them as best you can. I know in our environment, we probably have out of the 1,700 devices, maybe 120 different vendors. So it's difficult to try to keep up with them. Try to get as much of that patching capability or software capability automated with their sites. Some vendors are better than others. Again, the same thing happens with all those. You just try to stay ahead of the game as best as possible. Point of site security. If you've got, I mentioned this a little bit in the procurement process. If you've got devices that are coming into your network, are they LDAP capable? Can you put USB locks on them? Can you change the admin passwords? Because as you probably know, if you need an admin password for a major vendor, you go on Google or go on the internet and search the application, and you can probably get the admin passwords for those. And I would strongly recommend that you keep the admin passwords in your CMMS so your team knows where to get them. That should be your source of truth. Develop routine monitoring and preventive plans and processes. So just to kind of keep ahead of the game, just figure out what that's going to be. How often you're going to look at these ACLs that you've created. Is there any need to adapt a different strategy to those, or see if there's something more to do with those? And then I just want a couple last slides I have here is just some samples of some security incidents just already in 2020. And knock on wood that ProHealth is not on this list. In Health Share of Oregon, a laptop got stolen. I see in the little smaller burger dots the cause, the improper disposal of patient records was the next one. A ransomware attack, phishing attacks, email hacks. I mean, there's a variety of different reasons that these things are happening, and just kind of this is why we're in this business. We try to keep our patient data safe, try to keep our organization safe, and try to keep my job. More phishing attack, accounting firm hit by ransomware attack, more ransomware phishing stuff. So it's out there, it's prevalent. Chris alluded to this in the beginning of the webinar. They're not taking a break. If they're working from home with this COVID thing, they're still active as much as we try to be active on our side, keeping things safe. So that's pretty much what I had from my presentation. I appreciate you listening. And I'll give it back to Jamie, see if there's any questions.
Absolutely, Dave. I appreciate the presentation today. And while you and Rob were speaking, quite a few attendees did submit some questions for us. Before we get started, I want to remind everyone you can still submit your questions for this Q&A portion by using the question feature on your dashboard. We're going to get through as many as we can for the 60-minute allotted time period. Any that we do not get through, I'm going to send over to the presenters today so they can follow up offline. With that said, the first question is, what should medical device manufacturers do better to alleviate some of the cybersecurity problems at a facility? Do you have any test recommendations that they should perform?
I'm seeing Rob's silence, so I guess he's giving it to me. There are some security tests that and I'm just drawing a blank on the actual security scan that they do. Some of the medical device manufacturers are doing these security tests, and the ideal thing, I know Mayo is real big on this in Rochester and Minnesota, having them do their security scan and presenting that to you, because there's different ways to do that security scan. So let me follow up on that question, Jamie, and I'll get some better details to that, and I'll present that back.
This is Rob. To add to that, we are actually finalizing a request for information form as we're looking at new assets, and we have developed about 60 questions for our vendors. And that is one of the questions, is have they performed a security scan, and can they provide those results to us?
Thank you. All right, the next question has a few acronyms in it, so forgive me if I'm stating them wrong, but there are so many VLANs for connected medical devices such as infusion pumps, PACs, patient monitoring, so on. How does your hospital tap to monitor all connected devices, TAPS?
Yes. So VLANs, virtual LANs, we deployed those. So this is 2020. I've been in this facility probably since 2005. The infrastructure, the network infrastructure man at that time said the best thing we could do is isolate everything by its own VLAN. Well, in 2005, that might have been the best thing to do. Right now, we are trying to get away from that. We're trying to isolate in a different way. Switches are much more capable of doing things now. What we do here with the TAPs is, again, we have those at our core data center. All the traffic coming through there, we just there's actually an application that runs the TAPs. It's called Ixia, IXIA, and that application can it's just a dashboard you can go into, and you can manipulate what particular VLANs you want to send to a tapped I guess I won't say a switch, but a tap element that will then be sent over to the application. I'm thinking that answers the question, but it just, how do you do that? You just kind of, when I talked earlier in the presentation with regards to doing it off the core switch, what we were finding on the core switch was the CPU traffic was getting so heavy that it was causing some degradation on the core switch. This instance, what happens when you tap it off of the data center, it's just another spawn of the information going into your Ixia application, which then passes along to our application. So it causes the traffic not to be so inundated on the core switch, and that was the goal we did with that. So you identify what VLANs you want to send to it. In this instance, we are actually just sending all of the information to the application. And if you looked at our application right now, we've got, with all the servers and the resource in the servers and the workstations and phones and whatnot, we've got about 37,000 items hitting the application right now. That's it.
Great. Next question from the attendees. How often does your hospital perform baseline measures? For example, is it once a month or whenever a new device is added to the network?
I'm gonna assume what I understand to be a baseline measure, and I also want to caveat this with that might be more of an IT question, and the networking team might be doing some of that stuff. But I think we do. From the IT side, I know that they're doing scans for various things. Well, they're doing scans for various things almost on a daily basis. But to specific question, again, I think I'd rather not say something inaccurate and go ahead and get some better details and respond to that in post this webinar.
Perfect. Let's move on to the next question. Do you do any testing of the ACL before implementation in production?
Yes. And I kind of alluded to that, and I might have skipped over pretty quickly. So again, we look at a device. One thing I did lack to tell you guys, we do communications to the departments. In this instance, I'll use the example I was using earlier, the radiology ultrasound machines. So I'm in constant communication with the radiology ultrasound department. I'm in constant communication with the network team in IT and the PACS department. So if any of those departments are having issues or they get a call about an ultrasound machine, we know where to focus our attention initially on if it's a networking issue. In the example I was giving earlier, we had 10 ultrasound machines. I would take one of you would try to get a busier ultrasound machine and put it in this ACL profile and put it in if you want to call it, in a test production environment, so that one device is being restricted based off our ACL. Let that cook for 2-3 weeks, whatever the comfort level is, and then once we feel that that is good, then we put the rest of the other nine in that same profile, and then you're in a full production environment for those devices.
Perfect. I'm glad you brought that example back up, Dave, because this next question ties to it. In the example you gave for ultrasound, is it assumed that they are all from the same manufacturer to be on the same VLAN? How do you then manage large number of VLANs as you implement microsegmentation?
Excellent question. Yeah, and that affords me the opportunity to clarify. Yes, your ACL, at least the way I've found this to be, I can answer that a couple different ways. If you weren't in desire of remote access, then multiple vendors could probably be put into the same ACL. Meaning, if you've got I'm just going to throw, that didn't matter. Manufacturer A, manufacturer B, ultrasound machine, they're doing the same job in the radiology department, and they're talking the same servers internally, the same servers, PACS and whatever it may be, the storage device or whatever, then yes, technically you could put those in the same ACL because they're doing the same thing. What we're finding, though, is that manufacturer A has its own phone home IP address or networking characteristics, where manufacturer B has its own. So one may be actually to Japan and one may be to Sweden, whatever the case may be. And so that precipitates the need for two different ACLs. And so we are actually just going forward with that our criteria for an ACL is manufacturer and model, and then communications within that model.
Next question, just to shift topics a little bit. How is cybersecurity risk scoring factored into your 5-year replacement planning?
So this is Rob. I'll speak to that. It's one of the segments that we just recently started adding to our 5-year plan. As we go through and we look at that equipment and what needs to be cycled out, we take into the consideration of, what is its operating software? Is that obsolete? The platform software, and if it is, or if it's coming due, then our project manager will sit down with Dave, they'll have the conversation. All right, is this something that can be upgraded and we can then extend the life of the device? Or if it can't be upgraded, do we have to look at replacing that? If it's the latter, and if it's something that drives the replacement, then we're starting to add priority to those devices to say, yes, this device may still have useful life, but because it can't be upgraded and because the operating platform is obsolete now, we want to move that higher up the list to add some importance on it, just from a security standpoint. And so we make that visible to our senior leadership in the organization to say, yes, while this machine may not have reached its physical life expectancy, we have reached its end of life from a security and safety standpoint. And then we have to make that decision of a judgmental basis. Do we want to go ahead and implement some of these micro-segmentation rules to hopefully limit exposure to our network and then continue out the life of the device? Or is it important enough that we go ahead and replace that piece of equipment sooner?
All right, guys, we're going to see if we can get through one or two more questions. I'm going to send you over quite a few when we wrap up today. This attendee would like to know, are you seeing that network attacks are trying to get to the hospital infrastructure or the device on the network?
So I have not actually been told of a lot of, well, let me answer it this way. And Rob feels the same way. I know he's always said that our biggest concern is from within. As you saw in the examples I gave, a lot of those were phishing emails or ransomware. Ransomware usually comes from a phishing email. So a lot of our concerns are internal. But specific to the question, I think that it could be either way, and I hate to be so elusive, that it can be a specific device that has the issue, and then the issue comes from a medical device to the network, or it could be that they're somehow getting attached to our network and then causing some havoc from there. There really is. I have not been told internally. I've not been told that we're having these specific things occurring in our network that we need to be addressing. It's more of a exposure to the vulnerability that we have, like the Blue Keeps, the WannaCries, and the things of that nature. That it's going to be a device level attack.
A big thank you to each of our presenters today. Thanks again, Dave and Rob. Also, another thank you to today's sponsor, Armis. For more information on Armis's products and services, please visit armis.com. Today's presentation is eligible for 1 CE credit from ACI. Within an hour's time, you will receive an email with today's post-webinar survey. You must complete this survey to receive your certificate. If you have any questions, you can reach us at webinars@mdpublishing.com. Next week, we will be back to our normal schedule of 1 webinar per week. Join us on August 5th to hear Stephanie Anderson of Zulafly and Alan Tangen of Eaton Lighting present RTLS for multiple industries and contact tracing. You can register by visiting webinarwednesday.live. All right, guys, make it a great week. We'll see you back next time. Thanks for participating in Webinar Week.